Self-help for infertile couples. If you want to find out more about what you can do to help yourself solve your problem of infertility in your own bedroom, watch the rest of this video. Infertility can be frustrating, no question about it, multiple reasons. You feel very helpless that you can't do something like have a baby, which everyone else seems to do at the drop of a hat. So obviously that affects your self-esteem, your confidence. It spills over into your bedroom because it's never just your problem, it's always a couple's problem. So obviously the marriage starts getting strained, in-laws start getting anxious, mothers start getting worried. When are you going to give us some good news? Not pregnant yet. What's wrong with you? Why aren't you doing this, that? And then you have all these friends and relatives and aunties giving you all kinds of advice. And the general sense is, yeah, push, go to the doctor, let the doctor help you, let the doctor find out what the problem is. And there's nothing wrong with going to a doctor. Doctors can be very helpful when you have a problem managing your infertility. Don't forget, I'm an IVF specialist. I am a doctor. I am Dr. Aniruddha Malpani. I run an IVF clinic at www.drmalpani, and I've been doing this for 30 years. But the truth is that not every problem which causes infertility actually requires medical intervention. There's a lot you can do for yourself, so there's no need to feel helpless or powerless. And the fact of the matter is, no one likes going to a doctor. You always find some excuse or some pretext not to go. So then January becomes February, becomes March, which means 2020 becomes 2021, and you wonder where all the time went, and you never went to the doctor to seek assistance. And then the doctor also sits and shouts at you, why didn't you come earlier? Didn't I tell you to do this? Why, it's been over 6 months, you've not even bothered to do any of your results. Who wants to listen to all that? And that's why you need to understand that there is stuff which you can control. Having said this, please understand, not everything is in your control. So if your husband has a 0 sperm count or your tubes are blocked, pretty much stuck. You will need to go, or rather come to a doctor like me. But a lot of problems are much simpler. They don't require anything so complex or difficult. Most of them are bread and butter variety problems. Now, these are very easy to fix, and the good news is you can fix it for yourself. You don't need to go to a doctor. But the problem is most doctors won't give you this option. This is the bread and butter which helps a doctor earn his income. So obviously doctors want to do things for patients. It helps them. So they're happy to do all these treatments and procedures for you. Artificial insemination, follicular monitoring, falana, dikana, this, that and the other. Great for the doctor, not necessarily great for the patient. So the good news is there are options which you have available. Let's look at ultrasound monitoring, or what is called follicular tracking, for example, to track your fertile time. Now, if you're ovulating on your own, there are much simpler ways of doing this. Who wants to go to a clinic, wait in a line, 30 minutes, 60 minutes, and then go on the couch, keep your legs up in the air for everyone to come and watch what's happening, and this doctor puts this big fat probe inside your vagina and tries to see whether the follicle is there, how big it is, all that stuff. And then it's not just enough doing it once, you have to go back again the next day and the next day, and then on the day you ovulate, you tell your husband, come on, let's have sex. And the husband says, sorry, I have a meeting. All kinds of rubbish. I mean, who wants all this? It's bad enough being infertile, and all this stress is just going to make the infertility worse. Now, a doctor really doesn't care. They do this for a living. They do this day in, day out. So what's the big deal? Yeah, we're just doing a vaginal ultrasound scan. Yeah, you need to remove your clothes. Yes, it's an internal scan. Obviously, no big deal for the doctor. Big deal for you as a patient. No fun, loss of privacy. You kind of always wonder, is that bedsheet clean? Does this doctor really know what they're doing? Why is it a new doctor every time? Do I have to sit and explain everything? Do they actually know what they're doing? Hey, the last time he said was on the left side. Now why is he saying it on the right side? Hey, last time it was 14 mm. What's happened? Has it become bigger, smaller? 50 different questions. You don't know what's happening. So good news is you can track ovulation for yourself without spending so much money on these ultrasound scans, which are expensive. Follicular tracking adds up and consumes so much time and energy and disrupt your life. You can use simple cervical mucus tracking, or you can use ovulation prediction test kits. Want to find out more? Go to our website. It's www.drmalpani.com, and there's tons of stuff on what you can do to track ovulation monitor. And the good thing is, if you're tracking for yourself, then you can tell your husband well in advance, hey, I think this is my fertile time, this is the time I need to be seducing you, or you need to be seducing me, or we need to time baby making sex. So you're much more in control of your life, which I think is really important for infertile couples. So much for the woman bit, the ovulation bit. But obviously, just ovulating is not enough to get pregnant. You need to put the sperms inside. And often the reason for infertility is not a medical problem, it's a sexual problem. Either the husband's too stressed out or doesn't have time or can't get the erection when you need him to, which causes so much frustration. This is my fertile time and you can't even get it up. How am I ever going to get pregnant if you can't cooperate? Which causes fights, and then poor guy, not only is he miserable because he's wasted that cycle, the next cycle, that's always in the back of his mind. I couldn't get an erection the last time. Maybe I won't be able to get an erection this time either. It actually becomes a self-fulfilling prophecy. And what do you do about it? Because it's such a touchy, sensitive issue. Again, you can go to a doctor, but not a great solution. You can solve your problem for yourself by doing something called self-insemination. Self-insemination, as the name suggests, is self-treatment, which you can do at home for yourself. People have been doing it for donkey's years. Not something doctors tell you about because they'd rather treat you themselves rather than help you to treat yourself in your bedroom. But if you want to find out more, go visit our website at www.drmalpani.com and search for self-insemination. The information's there. You can do it for yourself, or if you want, you can buy the kit from us. We're happy to courier it to you. And if you have more questions, feel free to email me and I'll be happy to reply. Again, there's a free second opinion form on the website. You'll get a reply in 24 hours. We look forward to helping you to have a baby. See you online, and if we can help, we'll be more than happy to do so. Don't forget, that's the reason I became a doctor in the first place. It doesn't matter whether you have a baby because you come to me in my clinic to get pregnant, or the advice or the kit helps you to have a baby on your own. The joy we get will be exactly the same.